So we have our next speaker, Dr. ADIT GUPTA, who's going to be talking on my ideal patient for fillers, and is a very young, dynamic guy, specialized in oculofacial plastic and reconstructive surgery, practicing in Bansal Vision Institute, Maharashtra. So on to you, Dr. ADIT. Can you share your screen?
Yeah, is my slide visible now?
Yes, yes.
So at the onset, good evening, everyone. I would like to thank Team AIOS ARC for giving me this opportunity. And actually, Dr. Aparna's talk was the perfect prelude to what I would be discussing. I was told to speak upon how to choose the ideal patient for fillers. Now, this itself is like a big topic, which I would divide by speaking about how to screen an aesthetic filler patient, how to do an assessment of a filler patient, certain clinical scenarios, and which patients to avoid. Now, rather than speaking on how to choose the ideal patient for fillers, it is the other way around, mostly in our practice, where we try to screen the patients who might cause trouble in your practice, especially while dealing with these patients. And as Aparna rightly mentioned, that the doctor-patient relation is now slowly, because of the Consumer Protection Act, turning into doctor-client relation, which is causing a lot of trouble. And a lot of these cosmetic patients who walk in don't want to be called as or addressed as patients. So medico-legal aspects are cropping up. But if we look into how to choose an ideal filler patient, we need to understand that although we are ophthalmologists to begin with, in surgical subspecialties like ophthalmology, we have certain objective outcomes to look at. Like after a cataract surgery or after a LASIK refractive procedure, you would look to achieve good vision where we can objectify it by reading the Snellen's chart. But aesthetics, on the other hand, is more about experience and emotion. In many cases, we all get shocked that the objective outcome is not important, but understanding the psychology of a patient is the key to a successful aesthetic practice. I would give a very small example to begin with. This is one patient who came to me early in my practice when in 2017. She was basically a hyperthyroid patient, had lost a lot of weight and complained of looking sad and losing a lot of fat on her face. So on the first visit, I suggested her to go slow and go ahead. If you look, after 4 cc's of hyaluronic acid fillers in the middle photo, you can see there's not much change. I personally wasn't very happy. There's not much change, but the patient was ecstatic. I don't know why she was ecstatic, but she stuck on to me. And this is after 3 years of follow-up where I've almost injected 14 cc's of filler into her face, maybe because of hypothyroidism. And now she certainly seems to have settled in and has a result which is better than how she began with. But this patient has stuck on to me, comes to me every 6 months and get fillers done. Although I personally don't see that magical effect in her. So this is what made me wonder that how do you choose your ideal patient? Now, becoming a competent aesthetic physician or a surgeon is a yellow belt if you relate it to karate. But when you start understanding who to take on as a patient and when to say no, you achieve the brown belt. But a black belt is only achieved when the patients whom you have said yes and where you understand what makes them happy. Now, screening out a filler patient is how you want to say no. There are certain warning signs which you see. One is if the patient turns out to be very manipulative and talks differently to the staff and then talks differently to you, calls you by your first name without your permission, is excessively manipulative, charming, and fawning, and has unrealistic expectations. Secondly, if the patient keeps on pointing out flaws of other physicians whom they have seen, but you, on the other hand, are the most wonderful doctor that they have met, and they try to persuade you into doing certain treatments. Third, you would not want to touch a patient who is extremely depressed or anxious, and a patient who pays excessive attention to details, like would get a mobile phone and show you certain pictures and try to tell you to emulate these pictures in their body parts. You also pay attention to your staff because staff is your best friend. They tell you how the patients behaved with them in the clinic. And then there are certain soft warning signs where the patient tells you that she has a big wedding coming up next week, or talks about finances all the time, or is fixated on a specific procedure which might not be appropriate to them. So all these things are the psychological aspects of how to decline and when to decline a patient. So these are the aspects where you don't want to choose these patients for your procedures. Now, this is one very major aspect which comes into our practice. This is a case scenario where a 40-year-old musician came to me because she did not like the shape of her eye, and because of which she stays home, uses glasses, cannot get out, brings a lot of marked photographs, gives history of multiple surgeries, but clearly enough doesn't want to disclose the name of the surgeons, and has tried fillers as well and is unhappy. Now, it is obviously written on her face that this is a clear-cut case of body dysmorphic disorder. So this is a very common disorder that you need to screen out in your practice. These patients are severely narcissistic. They have an unrealistic view of themselves, are addicted to surgeries, and begin very young. And if there was a study in the US which concluded that you see in oculofacial plastic surgery, almost 6 to 7% of these patients that you see in your clinic would turn out to be some grade of body dysmorphism. Now, you don't need to screen all of them out, but the severe body dysmorphic disorders need to be really rejected and not provided any form of treatment, because it's just a chain reaction. After you, she's going to go on to another physician. Now, is there an ideal filler patient? I think ideal filler patient is a myth. Rather, you can have a happy filler patient, and there's a very fine line, and you need to strike a balance between an ideal and a happy filler patient, and you need to look at how you can make these patients happy. Now, in ophthalmic practice, usually patients that we get as referred by ophthalmologists, apart from dermatologists, are post-LASIK patients who uncover their glasses and notice blemishes in the under eye region. Young patients who have genetic under eye problems, post-blepharoplasty patients who have hollowing, and then there are functional issues like eyelid retraction, which Aparna has already pointed out. Now, in the ophthalmic subspecialty, usually you would want to do fillers and focus on fillers in the eyebrow unit, the temporal fossa, the upper eyelid sulcus, and the lower eyelid mid-face complex. Shubhra has also mentioned about complete evaluation of all these patients. So it includes also looking at the skin quality, texture, extent of volume loss. You don't want to promise a patient like this magical results just with filler alone. She will need a lot of combination therapies. So you need to know about that as well. You need to screen out fluid retention in patients, because these are strictly no-nos for filler injection. Fillers are hydrophilic, so they attract a lot of water and cause more fluid retention. On the other hand, a young patient with good skin quality, a little bit of tear trough hollow, is the ideal patient for a tear trough filler, as seen in this picture. You need to know your anatomy very well. There's the orbital rim hollow, the septal confluence hollow, and the zygomatic hollow. Usually the tear trough defect is at the orbital rim hollow, and this is the defect most commonly filled during a tear trough filler injection. Now, coming to case scenarios which are ideal for us as ophthalmologists to deal with, Dr. Milind has published a paper about how post-refractive patients need to undergo photography without their glasses before undergoing a refractive surgery, because a lot of them attribute these under-eye circles and darkening due to LASIK surgery. Now, this young lady was referred to me because after her LASIK surgery, she noticed under-eye dark circles, and it was just a case of pseudo dark circle where she had a little bit of fat prolapse, and just with 1 cc of filler injections, we could achieve a good result. And once you make these patients happy, they keep coming back to you for further indications and further cosmetic therapies. Second case scenario, which we very often deal with, is a bony hollow. Now, these are purely genetic defects. These run in families. These are typically young patients with a deep tear trough deformity due to bony architecture, as well as loss of soft tissue. These are ideal patients for filling as long as their skin quality is good. I'll come to that later. But these patients can be very well dealt with hyaluronic acid fillers. Just 1 cc usually suffices. If you need to treat the mid-face, you can do it as a conjunction. But most of the patients are usually happy with these filler injection results. I'm not showing the video due to paucity of time. Third scenario, where you can camouflage a particular grade of eyelid bags with filler injections, is where there is mild to moderate fat prolapse, where the patient is not ready for a surgery, has a good mid-face architecture or profile, and has good eyelid tone. Because when you're adding fillers to the eyelid, you're adding weight to it. You don't want to do fillers in a patient with gross ectropion or gross eyelid laxity. So obviously, moderate fat seen in this lady, you can camouflage it with a filler and get good results and avoid a surgery for the time being. On the other hand, such patients who are on the edge can undergo surgery as well as filler injections depending on their choice. This patient underwent a blepharoplasty surgery, so the results are not different from a filler injection. Now, fillers can also be used as a combination in such patients where she has an upper eyelid hooding or dermatochalasis, which was corrected with a upper eyelid blepharoplasty. But she also has a deep tear trough along with little bit of along with skin thinning. So this patient underwent a combination of upper eyelid blepharoplasty with a lower eyelid Restylane or a hyaluronic acid gel filler, and this is the result for you to see. So combination therapy is also a good option when you want to deal with a patient who has multiple issues that need to be sorted out. Last but not the least, we should not leave the eyebrow away. Most of the patients, especially beyond the age of 50, undergo eyebrow fat pad deflation, which causes drooping of the eyelid skin and the eyebrow beneath the orbital rim. Such patients can undergo a blepharoplasty combined with a little bit of eyebrow filler injection. We have published about this, our experience with eyebrow filler injections. This usually done in the retroorbicularis fat pad or the eyebrow fat pad, which gets inflated with the filler injection. It is a very safe injection. And it's very commonly seen, as Dr. Kasturi would agree, in Northeast Asian or Asian patients who have a type of sulcus deformity, which looks very good when filled.
One minute remaining, sir.
Yes. Last but not the least, functional patients like thyroid eye disease, which already Aparna has covered, can be treated with hyaluronic acid gel fillers. Usually, we try to treat with hyaluronic acid gel fillers if there is an aesthetic concern in a burnt out thyroid eye disease with a tight eyelid, or if there is some sort of exposure. Usually, I don't treat patients with proptosis with fillers. Only pure eyelid retraction patients can be treated well with filler injection. After looking at the psychological aspects and ideal case scenarios, we also need to know whom we should not touch clinically. Now, this middle-aged lady has came to us with under-eye concerns. You can see that she has a tear trough deformity, but there's a lot of pigmentation as well. Now, under-eye pigmentation is a very difficult subject to treat. There have been a lot of creams and under-eye treatments which have come, but most of the under-eye pigmentation is very resistant. Sometimes it could be associated with systemic conditions or increases after pregnancy or after hormonal imbalance. Now, this young lady who was treated with under-eye filler when I was early in practice, you can see that she kept coming back to me complaining that there is some sort of pigmentation still left, and the pigmentation sometimes gets unveiled after a filler injection. So you need to be very careful while injecting this. Secondly, you need to be very careful while injecting patients with malar edema. So she had a little bit of malar edema, which maybe I missed on my first examination. And these are the patients who have a rough course after an under-eye filler injection. They keep troubling you. You have to do a lot of hand holding, and eventually it takes months sometimes for this for this fluid to settle down. She still has a little bit of persistent fluid. Also, these patients could be the patients who have hypersensitivity and fine skin where you can see a little bit of Tyndall effect from the filler. Last but not the least, Aparna has already spoken about this, but some patients are allergic. Now, this young male came to us, and this picture which I've taken on the left-hand side is after application of topical prilocaine. You can see that his skin has turned a little boggy after application. So this is a sign that I shouldn't have missed. He has a tear trough deformity. At 1 week, he looks very good. But when he comes back at 1 month, he's very unhappy because he has this sort of hypersensitivity reaction delayed kind, and also a little bit of hyperpigmentation in the tear trough area. So these are the certain signs which you need to look at and sort of be careful. Obviously, this can be dissolved and reversed, but you don't want an unhappy experience for your patient. So to summarize, you should screen all your patients for body dysmorphism when you're dealing with a filler patient. If you are not confident, or if you think that the patient is oversmart, you should try and send them to your competitor. Triage these patients as to whom you want to touch, whom you don't want to touch. Avoid fillers in patients with fluid retention and allergies, frank allergies. And also the patient who understands the need for repeat injections, because the effect of fillers lasts for around a year or so, depending on which area we have injected, and understands the economy of these procedures. Thank you.
Wonderful talk, Dr. Adit. Dr. Shubhra, you have some questions to take?
So I think Adit has very well presented and covered the periocular concerns, including the pigmentation, teardrop, and the cheek hollowness, and how to choose the ideal patient. I think that's very, very applicable put forward. Adit, I have just one question. Now, suppose you have a patient who comes to you with unrealistic expectations. How do you tackle such patients in your practice? And most of these patients would have done the doctor shopping, and you would be one of them. So
Yeah.
how do you actually do the counseling and take it forward?
So I think when we are tackling an unrealistic patient, the most important thing to understand is that we have to be, the patient and the doctor or me, I have to be on the same page. So if the patient is not on the same page with me, especially if you see a lot of these patients who are actors or models, these are the patients who trouble you the most. They want you to inject according to their fancies or where they want the filler injection. So such patients, usually if they are not amenable to my treatment plan, I usually frankly deny them, or I just gently, politely decline and tell them that I'm not the right doctor for you. You can choose to go to any other qualified doctor. If they are amenable to my plan and if they don't have unrealistic expectations, then I go step by step. So I try and see if I can sort of make a plan over a period of 6 months and tell them that let's begin with one syringe. If you like the effect and you want to stay with me, then you come back to me after a month or two, and then we can go ahead in a graded fashion. So I usually try to delay their treatment or try to assess their treatment over 2-3 visits. If at any visit I think that I cannot fulfill their expectations, I just refer them. But all said and done, I think the most important thing for us to realize is that we should never, even if the filler injection or whatever procedure has been done is not up to the mark, we should try and avoid speaking about the earlier doctor, because sometimes it might fire back upon us. So that is one thing which I avoid whenever I deal with such patients.
Nicely put, Adit. But in my experience, and I would ask other panelists on board to have their experiences being shared here. Actually, more and more what I see is these patients who are difficult patients turn out to be your best spokesperson if you deal with them properly.
Yes.
So I think, yes, your moderate dysmorphic syndrome patients definitely have to be wooed away and to be handled carefully. But if you have a difficult patient, and I mean, difficult in the sense of the indications and the experiences they ever had, and if you handhold them and take them slowly, I think they become your best candidate. So there is always a thin line of understanding who's your ideal patient and who's not.
Yeah.
And I would like to have inputs from Dr. Bilin, Dr. Kasturi, and others on the panel, please.
Hey, Shubhra, hi. Well, as long as the patient understands the science behind the complexity or the complication, I'm okay to do the hand holding. Once they start getting unrealistic, um, I follow the same strategy of sending them to the competitor, or just letting them know that there are other people who are more experienced than me and they should take a second opinion or a third opinion.
Kasturi, anything to add before we go on to our next speaker? I think we're running short of time.
I exactly try to put myself in their shoes. This type of patient, sincerely speaking, I feel very sad. I really want to help them. And very recently, there was a child who had this problem, and he had visited many places, different parts of India, and I feel so sad. I really spent hours and hours with him and try to understand his psychology. Ultimately, he was not happy with his eyes. He felt that one is bigger, one is smaller. And ultimately, with multiple discussions, I had done the procedure. And, he was so depressed, he was an IIT and he stopped going to college. And now, I could see the positivity. And very recently, he got selected in one of our, major institute in US, and he has moved there. So I just don't like to, chase them away. To be very frankly speaking, I really want to be with them. And somehow from my inner heart, I really want to help them. And that is what I feel. with multiple discussions. I really need try to give them maximum time possible. Like I feel sad for this patient, to be very frank.
No, I think there's a very specific personality of patients who come to your practice. So it's very difficult to go and please all of them, I think.